Hi everyone, Liz here from Tutor2 Health and Social Care. Thank you for joining me this lunchtime for a live stream for Unit 2 Working in Health and Social Care, which is part of your BTEC National Programme. And today we're going to be looking at information management and communication. So if I just load up our activities for today. So I'm sure you've probably joined us before. To get the most out of this, please do type your answers in the chat. You need to be a subscriber to be able to type your answers in the chat. And also, if you do so, I will give you a shout out, either for you as an individual or for your school or college, or if you're with your class, let me know. Okay, so we are going to start with a Captain Riddles activity. If you've joined me before, you know there's a little bit of music, and don't get too surprised when Captain Riddles punches the screen. So here we go. Okay, so Captain Riddles is going to give us 3 clues and we are looking for a key term. Remember, we're talking about information management, data management and communication. So it could be a key term or concept, maybe a piece of legislation relating to those topics. So our first clue . Sets out rules for the use of personal information. So rules for the use of personal information. Clue 2. So this includes online and paper-based information. So these rules include online and paper-based information of a personal nature. And clue 3, final clue. Has 8 key principles, including information relating to, and I've missed the end. Okay, including information needing to be kept safe. Just had a look at it on my other screen. Okay, so set of rules or principles. It's about keeping information safe. It can be online or paper-based information. So what is the key word, or could it possibly be a piece of legislation we're looking for, because we're talking about rules? If you know, if you're at home, school, college with your class, please type the answer into the chat. Makes it much more fun. Shall give you one more moment. You can see there's quite a few of you joining us live. Don't be shy, let us know your answers. Okay, Ninoska says lone worker policy. I can see what you're thinking, but this is much more related to information management, okay? So have another think, Ninoska. So a set of rules about using personal information, personal data, could be online, could be paper-based. I'm sure there's some people shouting out in their class. I will reveal the answer. Remember, Captain Riddles is going to punch the screen again. It is the Data Protection Act 1998. Just a little tip on that. In your exam, if you had a question where you wanted to talk about the Data Protection Act, if you can remember the date, put it in, but don't forget if you have, start again. Don't panic if you forget or you don't remember the date. The most important bit is Data Protection Act. Okay, so give the date if you can remember it, but don't panic if you can't remember it. Okay, so we're going to do some true or falses about the Data Protection Act. So I'm going to read out a statement and I want you to give me either a true or a false. You can give me a T, an F, thumbs up, thumbs down, smiley face, sad face. I don't mind. So the first one, the Data Protection Act 1998 allows individuals to request access to the personal data that organisations hold about them. Is that true or is that false? What do we think? If you're with your class, nominate someone to answer, maybe your teacher. If you are on your own, let us know. Okay, so we've got, I think that's a smiley face. It's not coming through very well on my my screen. I think it's a smile. Yeah, purple devil smile. Okay, I agree with you. It is true. Well done. So our next statement. The Data Protection Act 1998 covers systems for accessing information, not just the information itself. So Does it also regulate the software, the computer systems, the computer networks that we are using to access information? So does it cover the system as well as the information? So if you think it covers both, then you're saying true. If you think it only covers information, you're saying false. So let me know. What do you think? Okay, that one is also true. So remember, the Data Protection Act says things about having security, data security, information security, preventing breaches, using passwords, lock screens, and so on. Mia Potter says true. Thank you, Mia. Yes, it is true. So it covers the system that you access the information on, so the software, the program, even the equipment, and the information. Okay, next one. Under the Data Protection Act 1998, organisations can share personal data with third parties without the individual's consent. So a third party means not the healthcare organisation, not the individual, but someone else, a third person. So maybe, I don't know, a commercial organisation, a business. Can we share that information without the individual's consent? What do you think? Is that true or is that false? Mia is saying false. Anyone else want to wade in on that one? You're absolutely right, Mia. Well done. So we have to have consent to share that information outside of the organisation. Also, if we share information within the organisation, we should get their consent, or we should have their agreement in advance that we can share information, perhaps between doctors and nurses, for example. Okay, next one. The Data Protection Act 1998 only applies to digital data, not to paper records. Is this true or is this false? Think about that Captain Riddles that we had earlier. That did give you the answer to this. So the Data Protection Act 1998 only applies to digital data, not to paper records. Is this true or false? Okay, Nanoska's saying false, straight off. I absolutely agree with you. So there are still quite a lot of paper records in healthcare. It's becoming more digitalised, but there are still quite a lot of paper records. Data Protection Act covers those as well. I think we have one more of these. So the Data Protection Act 1998 requires that personal data be kept for no longer than is necessary for its intended purpose. Is that true or false? So I'll read it again. The Data Protection Act 1998 requires that personal data be kept for no longer than is necessary for its intended purpose. True or false? So I appreciate the wording on this one is a little bit tricky. Okay, Mia's saying true. Yep, you are correct. So what it's saying is that all data that's collected has to be collected for a purpose. For example, if a woman is pregnant, then we need to collect data and information about her pregnancy. What the Data Protection Act says is that we can only keep that for as long as it's necessary for that purpose. Now, it turns out that in terms of having a baby, it can actually be kept for 25 years. The reason being that if the child experiences any trauma at the time of birth, which could cause disability later on in life, they have the ability when they're an adult, when they reach 18, to have that investigated and maybe get some payout for that, okay? Whereas if you went to hospital to have your tonsils removed, maybe that doesn't need to be kept for 25 years because that only has an impact on your health for a short amount of time. Okay, so you have to collect data for a specific purpose and then only keep it for as long as it fulfills that purpose. Okay, so now I'm going to give you a 60-second categorise activity. Nice and simple. I want you to split these 8 statements into examples of confidentiality being kept and examples of confidentiality being broken. So to give me your answers to this one, you can write kept and then tell me the numbers, and then you can say broken and then tell me the numbers. I'm going to give you 60 seconds of music. Hopefully, fingers crossed, the music will work. Here we go. Okay, so Cushy, hi Cushy, is telling me that number 1 would break confidence. So talking about patients in lifts is an example of breaking confidentiality. Mia has said number 1 as well for breaking confidentiality. Also number 3, sending work emails on personal accounts. Yeah. 4, posting about patients on social media. 5, patient records open and on display. And 7, sharing login details. Yeah, brilliant, Mia. And then Mia is saying confidentiality is kept by number 2, so controlling access to information. Number 6, records kept in locked cabinets. And number 8, private conversations. Nanoska agrees with you. So let's have a look. So a really nice simple activity. So we keep confidentiality by locking away information. So those paper records that I said about, we must keep them in locked cabinets or locked rooms. We should have conversations in private. We should control access to information. So that means things like password protection, only authorising people to access the information that's required for their job. And then lots of examples of how you break confidentiality. Fabulous. A round of applause and an air horn. Okay, so thinking about that Data Protection Act, I'm looking for 4 principles of that act. So 4 features or principles or characteristics or elements, things that you can remember about the Data Protection Act. And I'm going to give you 30 seconds to do that. Oh, sorry, I muted myself when I drank my water. Data must be accurate and up to date, be collected and used honestly and fairly, must not be passed on to other organisations without permission, and not kept longer than is necessary. Mia is saying lawfulness, yep, confidentiality and integrity. Nanoska is saying fairly and lawfully. So that's about the processing of the information. So it'd be really useful for your Unit 2 exam if you could think of some examples of those things and relate them to health and social care. So, for example, for first one, data must be accurate and up to date. That's really important because if there is inaccurate data or old information in a patient's records, that can change the decisions that are made about their healthcare, which could then cause them harm. We have to use their information honestly and fairly because we need our patients to trust us. We shouldn't pass on their information without their permission or consent because that's unlawful. Also, it's morally questionable as well. And then we shouldn't keep information longer than is necessary because that can be seen as a breach of someone's rights. Okay, so think about how you can link these principles to health and social care examples. Okay, so on the screen I have got lots of statements. I want to know which of those statements on the screen are ways to ensure good information management. So you can just say, if you said C1, encrypting data, to give me that as your answer, just type C1 into the chat. You don't need to write out the whole thing. So how many of those are good information management principles or practices? So you don't need to do them all at once. As soon as you see one, just write in C1, for example, and so on. I'm going to look through. Okay, Nanoska is saying 1D. Two-factor authentication. Yep, so that's having two methods of authenticating a user to ensure that they are the correct person. So two-factor authentication is supposed to be more secure and less likely to be hacked. Sevda is saying A1, leaving computers unlocked. That's actually poor information management. Oh, D1. Yep. Two-factor authentication. So yeah, leaving computers unlocked would be poor information management because that could mean that anyone could access them. So when we talk about locking our computer, we mean password locking it. Mia's saying A3, staff training. Yep, absolutely. So you need to ensure that your staff are regularly updated and trained into how to manage information in the best possible way, how to keep things secure and safe. I would add B1, so monitoring access, so finding out, keeping a check on who is accessing what to make sure people aren't accessing what they're not supposed to. Nanoska says 4D, using secure portals. Yeah, so this is really important if you share information. So if you wanted to share information between maybe health and social care services, there might be a secure portal, so like a secure piece of software where you log in using two-factor authentication, then you can upload information and it's encrypted and kept secure so that only another person that's authorised can download or access that. That links to C1, doesn't it? Encrypting data. So encrypting means like encoding it so that if a casual person got hold of the document, they wouldn't be able to read it because it would be encrypted. What do we think about 2A, using public Wi-Fi? Is that good or bad? What's the problem with public Wi-Fi? What do you think? I think this is a big no-no because public Wi-Fi is usually a lot less secure. If you joined public Wi-Fi in a hospital, it might actually tell you, that this is not a secure thing. Yeah, Nanoska is saying, yeah, it's bad. It's more liable to be hacked. We need to log out of systems for sure. Throwing away patient records. That's an interesting one. If we need to dispose of patient records, do you think we just chuck them in the normal bin? Do we recycle them? What do we do with them? I'm going to reveal our correct answers actually. So if we need to dispose of patient records, they need to be shredded, and they would have to be shredded by an official company that does the right level of shredding, because you can shred a document with a shredder that you might have at home, but you could still stick that back together again, whereas you need a cross-cut shredder that shreds it into tiny little pieces and then it's disposed of correctly. So our good information management is in yellow. The things that we shouldn't do are the ones that are in white, okay? So monitoring access, encrypting data, two-factor authentication, logging out of systems. When you finish using the computer, log out. When you've finished using a particular piece of software, log out. Regular audits, that means checking that people are following policy, practice, procedure, that they're doing the right thing. Linked to staff training. secure disposal of records, which is what I just talked about, using passwords, not sharing them, using a private office whenever you can, logging documents, I think that should say as confidential, so you need to make sure that you know what is a confidential document and log it and label it as such, and using secure portals. Well done, everyone. Okay, so with the connection spinner, what we're going to do is we're going to spin the spinner and then work out the connection between effective communication and the thing that the spinner lands on. So we have, how can we communicate effectively with, and then we've got some people. We've got an individual with a hearing impairment, a young person who's frightened, an angry patient who wishes to make a complaint, a pregnant woman with English as an additional language, the family of a seriously ill patient, and a confused older patient with dementia. So let's spin the spinner, see where we land. Okay, so everyone at home, school and college, please type in the chat, how can we communicate effectively with an angry patient that wants to make a complaint? So just type 1 or 2 words to describe how we can communicate with that person, sort of like key things to think about. I will give you a little bit of music, I think. Are we going to shout at them? Are we going to be angry back to them? Okay, while I wait for you to type your answers, I will show you what I have. So Nanoska says respond in a calm manner. Absolutely, I think that's probably the most important thing that you can do. So I have got acknowledge their feelings. So it's really important that you say to someone that's angry, I can see that you're angry, because then you're validating, you're acknowledging their feeling. And often that kind of makes them think, oh, okay, someone's listening to me. Then you must communicate clearly and calmly, which is what Nanoska is saying, and actually tell them what the complaints procedure is. So every health and social care setting must have a complaints procedure, and it's not necessarily the role of the person that first knows about the complaint to investigate it. But what you can do is you can explain to that person really nicely and calmly, I understand that you're angry. This is our complaints procedure. This is how you get started with that procedure. If you need help, this is the person to contact. And in a lot of cases, that's sufficient to make a person kind of feel less angry, feel like they've been heard, and then maybe they will move on. Okay, let's spin again. How can we communicate effectively with a confused older patient with dementia? So anything you can think about that would be effective communication with someone that is confused, is older and has dementia. Remember, dementia is a condition that is commonly associated with ageing. It can cause forgetfulness, it can cause changes in behaviour, it can cause anxiety, depression, and so on. So let's give you a 30-second timer. Off you go. So the first thing I would say is, although Nanoska gave this answer for the previous question, it still stands. So responding in a calm manner is really important when someone is confused. While you type your answers, I will put mine on. So speaking calmly, offer reassurance. So if someone is confused, try and reassure them. You need to be kind and compassionate. compassionate, sorry, and not use any jargon. So, you know, jargon is words that maybe only healthcare professionals understand. So you need to think about an older person with dementia may have limited capacity to understand, especially if they're upset or confused or lost, okay? So it's about clear, calm communication, using simple language. It doesn't have to be patronising, but it should be simple language, and being really kind and compassionate. Okay, our final activity is news headlines. So I have actually scoured the World Wide Web for news headlines about communication and information management and data management. So you need to try and work out what the missing word is in each of the news headlines. So the first one, doctor fails to be blank and blank by lying about surgery on wrong leg. Okay, so any ideas? Doctor fails to be blank and blank by lying about surgery on wrong leg. What could we put in the gaps? I'm interested in any and all suggestions here. Just think about it being related to communication, what we know about good communication, and what we know about data and information management. So think about maybe some key elements of good, effective communication. I'll reveal this one, it might help you with the subsequent ones. So, doctor fails to be open and honest by lying about surgery on wrong leg. So it's really important in healthcare that workers are open and honest, both as a part of effective communication, but also accountability. So duty of candour says that we must own up when we make mistakes, and we must tell the person that is harmed by a mistake. So in this case, a doctor had performed surgery on a patient incorrectly on the wrong leg, and they lied about it. Let's have a look at our next headline. Nurse admits major blank after leaving laptop on train. Nurse admits major blank after leaving laptop on train. What do you think this could be? So what information might be on that laptop? Let's assume that it is a work laptop issued to that nurse by the NHS to manage their patient data. So what would the nurse be admitting if she left that on the train? Think of a key word. This one is nurse admits major data breach. So if you leave a laptop or a memory card or a work phone somewhere public, especially if you haven't password protected it, then that is a data breach, because it could be used to access patient information. Thank you, Ninoska. I think that's for the previous one, isn't it? Okay. Next headline. Social worker applauded for breaking confidentiality of man threatening to blank his partner. So social worker applauded for breaking confidentiality of man threatening to blank his partner. So we know that confidentiality is really important in health and social care, but occasionally we have to break confidentiality if harm is going to come to someone. So what do you think could be the blank here? This one is harm. So if there is a suspicion that someone may be harmed, then you can break confidentiality. It's best practice to advise the person that you're going to do it if they have capacity. So if an adult tells you about something that could cause harm, you can say to that adult, now you've told me that, I need to escalate this because that could cause harm to yourself or someone else. So you are doing it without their consent, you are breaking their confidentiality, but you have told them that you're going to do it. Obviously, that might not always be appropriate to tell that person. Okay, so thank you so much, guys, for joining me today. Let's have a round of applause and an air horn for everyone. So that concludes our information management and communication revision. I am back same time next week. Let me just check. Yep, we're doing accountability, inspection and regulation, which I know that students find quite challenging and less enjoyable, let's say. So hopefully a lot of you will be able to join me next week. So have a great week. Thank you so much and take care. Bye.